The blue flannel shirt hung in Sarah Mitchell's closet like an accusation. Her fingers brushed the fabric once, twice, 3 times before jerking back. In the kitchen, 2 coffee mugs sat on opposite sides of the table, one spotless, one ringed with 3-day-old lipstick she couldn't bring herself to wash. The apartment felt too quiet. Portland rain drummed against the window, the same gray drizzle that had followed her for weeks, months, really. Her phone buzzed another reminder from the doctor's office. Annual checkup overdue, 8 months. Delete. Sarah pulled up Instagram instead, scrolling through photos of strangers in exotic places. Turquoise water, sun-baked streets, freedom. Her thumb hovered over Jake's last text, sent 6 weeks ago. I'm worried about you. Not I miss you. Not I love you. Worried. She looked back at the shirt, at the unmade bed, at her reflection in the darkened phone screen. Then she opened a new browser tab and typed, "Flights to Colombia." Leave a like and share your thoughts in the comments, along with the city you're watching from now. Let's continue with the story. 3 weeks later, Sarah stood in the cobblestone plaza of Cartagena's old town, her skin sticky with Caribbean heat. The contrast felt deliberate. Portland's cold rain replaced by relentless sun that seemed to burn away everything she'd left behind. Her Instagram feed had transformed. Sunset photos, beach yoga poses, colorful street art, each caption carefully crafted, finally living. No regrets. Find my authentic self. The likes rolled in steadily. Even Jake had viewed her stories, though he never commented. Sarah told herself she didn't care. The backpacker hostel was full of people like her running from something, toward something, or simply running. She'd joined a group heading inland to a mountain village for a local festival. Real Colombia, the Australian guy had promised. Not the tourist stuff. Sarah wanted real. She needed real. Everything back home had felt like a performance, and she was exhausted from the script. The village of Santa Marta sat nestled in green hills, accessible only by a dusty 2-hour bus ride that left her teeth gritty and her clothes clinging to her skin. But when they arrived at sunset, paper lanterns already glowing between the trees, Sarah felt something shift in her chest. This was what she'd come for. The festival, Fiesta de San Juan, exploded with music and laughter. A local family, the Rodriguezes, welcomed the travelers with an enthusiasm that made Sarah's throat tight. When had anyone back home been this genuinely warm Mrs. Rodriguez? A woman with silver-streaked hair and knowing eyes, insisted they try everything: empanadas, arepa, chicha. And finally, with great ceremony, she presented a wooden bowl containing what looked like large roasted ants. "Hormigas culina," she announced proudly, her weathered hands offering the bowl to Sarah first. Very traditional. Good luck, strength, and, she winked, passion. The other travelers laughed and pulled out their phones. Sarah stared at the ants, their glossy black bodies catching the firelight. One of them twitched slightly. Not dead, she realized. Not all of them. Her phone buzzed in her pocket. She knew without looking it was another forwarded message from her mother. "Did you see the doctor recommended you for more tests?" Sarah's jaw clenched. She'd spent 8 months avoiding that conversation. 8 months being told she was overreacting to normal fatigue. 8 months of Jake's worried eyes following her around their apartment. She looked at Mrs. Rodriguez's expectant face, at the phones pointed toward her, at the moment stretched thin, between proving something and admitting fear, Jake's voice echoed in her memory. You never take risks. Sarah reached into the bowl, selected the largest ant, and brought it to her lips. The shell cracked between her teeth, crispy, nutty, earthy. But underneath, something soft squirmed against her tongue. She swallowed quickly, chasing it with homemade aguardiente that burned all the way down. Everyone cheered. Sarah smiled for the cameras, her throat already starting to itch. She had no idea the countdown had already begun. The first symptom arrived 3 days after Sarah returned to Portland. She woke to rain against her window and the metallic taste of old pennies coating her tongue. Coffee didn't wash it away, neither did brushing her teeth twice. Then a third time until her gums bled pink into the sink. Jet lag, she told herself, dehydration from the flight, the shock of gray skies after 3 weeks of relentless sun. But that night, lying in bed, scrolling through her Columbia photos, each one a small rebellion against the life she'd left behind, Sarah felt it, a scratch, deep in her throat, past where she could reach with water or lozenges or swallowing hard. She sat up, fingers instinctively flying to her neck. The sensation passed, almost. By day 5, the scratch had evolved into pressure. Something lodged against her soft palate, a fullness that made swallowing feel conscious, deliberate. She found herself clearing her throat constantly during video calls with clients, apologizing, muting herself to cough. Katie noticed during their coffee meetup on day 7, "You getting sick?" "There's something going around." Sarah wrapped her hands around her latte, grateful for the easy explanation. "Probably just my body adjusting back. You know how travel is. At least you went," Katie said, scrolling through Sarah's Instagram. "These photos are gorgeous. Jake saw them. By the way, he asked if you were okay." Sarah's jaw tightened, and she felt her teeth catch the inside of her cheek. She'd been doing that more lately, biting down on the soft flesh of her mouth without thinking, a nervous habit from childhood that had returned sometime after the breakup. Her tongue found the small, raw spot where she'd broken skin days ago on the plane, worrying it like a loose tooth. That night, she stood before her bathroom mirror with a flashlight, tilting her head back until her eyes watered. The beam illuminated the pink cave of her throat, her uvula, the arch of her soft palate, and there, barely visible in the back, a dark spot, small, no bigger than a freckle, but wrong, foreign. Sarah's hand trembled, the light wavering. She told herself it was a tonsil stone. She'd read about those on Reddit. Common, harmless, just calcified debris that looked worse than it was. She'd tried salt water, hot tea with honey, gargling apple cider vinegar that made her gag. The spot remained. By week 2, Sarah had convinced herself she was being paranoid. The pressure had become familiar, almost background noise. She threw herself into work, taking on extra freelance projects, anything to keep her mind occupied. Her apartment slowly organized itself. Jake's shirt finally donated. The second coffee mug packed away. She was moving forward, healing. The throat thing was just stress manifesting physically, her body's way of processing the breakup, the trip, the transition back to normal life. Except Sarah couldn't remember what normal felt like anymore. Week 3 brought the dreams, dark, suffocating dreams, where something pressed against her windpipe from the inside. She'd wake gasping, hand clutching her throat, certain she was choking, but there was nothing, just air moving in and out of her lungs. and that persistent pressure she'd learned to ignore during daylight hours. Then came the night she felt it move. Sarah had been brushing her teeth, bent over the sink, when the sensation rippled through her throat, not painful, not quite, but unmistakable. A twitch, a flutter, something adjusting its position in the soft tissue of her palate. The toothbrush clattered into the sink. She gripped the counter, staring at her reflection, pale, wide-eyed, a thin line of toothpaste foam at the corner of her mouth. It couldn't have moved. Things don't move. Tonsil stones don't move. But Sarah knew what she'd felt. She grabbed her phone with shaking hands, opening the flashlight app, tilting her head back once more. The dark spot had grown, not much, but enough to notice. And as she watched, throat muscles contracting around the light, she could have sworn she saw it pulse. Her phone slipped from her fingers, clattering on the tile floor. For a long moment, Sarah stood frozen, her reflection staring back at her in the mirror. The woman looking back seemed like a stranger, someone who'd eaten insects in a mountain village to prove a point, someone who'd ignored doctor's appointments and warning signs and the people who'd tried to care, someone who'd been so busy running from one fear that she'd sprinted directly into another. Sarah picked up her phone. Her hands steadied as she pulled up her contacts, scrolling past her Katie, past her mother, landing on Doc Hayes' office. The call could wait until morning. Probably should wait. It was nearly midnight, but the thing in her throat pulsed again, and Sarah's finger was already pressing dial. Dr. Robert Hayes had practiced family medicine in Portland for 23 years. He'd seen infected piercings, swallowed objects, allergic reactions that turned throats into battlegrounds. But when Sarah Mitchell sat in his examination chair that Thursday morning, describing a sensation of something living in her throat, his first instinct was to check her file for psychiatric history. "The pressure started about 2 weeks ago," Sarah said, her voice steady despite the tremor in her hands. "And I can feel it, not like inflammation, like something with weight, something that moves." Dart Hayes nodded. Typing notes, young woman, recent international travel, recent breakup according to last year's records, stress, anxiety. Health anxiety specifically was epidemic among her demographic endless Google searches, turning minor symptoms into catastrophic scenarios. "Let's take a look, Lucas," he said, pulling on gloves. His tone was gentle but professionally distant, the voice he used when he needed to rule out the obvious before addressing the psychological. Sarah opened her mouth. "Dr." Hayes positioned his headlamp and pressed the tongue depressor against her tongue, angling for a clear view of her posterior pharynx. He saw it immediately. His hand stopped moving. The tongue depressor remained pressed down, but his grip had gone rigid. "Don't move," he said, his voice stripped of its earlier patronizing gentleness. The thing embedded in Sarah's soft palate was roughly the size of a lentil, dark brown against the pink tissue. But it wasn't the size that made stir Hayes's pulse quicken. It was the subtle, rhythmic movement, a contraction and release that matched no human physiological pattern he recognized. He released the tongue depressor slowly, his mind already racing through possibilities. Abscess, no. The tissue wasn't inflamed enough. Foreign body not with that kind of independent movement. "Ms. Mitchell," he said carefully, reaching for his phone. "I need to use an endoscope just to get a better look." Sarah's eyes had gone wide, reading his face. "What is it?" "I don't know yet. That's why I need a closer look. The flexible endoscope was thin enough to pass through her nose and down into her throat. Hayes guided it carefully, watching the monitor as the camera descended. When it reached the soft palate, he adjusted the angle and zoomed in. The screen filled with magnified tissue, and there, half embedded in the mucosa, was something that made his 30 years of medical training feel suddenly inadequate. It was segmented, pale cream in color, where it pressed against the surrounding tissue, with a darker region that appeared to be burrowing deeper. And as they watched, it contracted visibly, a wave of movement that traveled the length of what Hayes could see. It was alive. "Miss Mitchell," he said, keeping his voice level as he withdrew the endoscope. "I'm referring you to OHSU immediately. There's something in your throat that requires a specialist." "What kind of something?" Sarah's voice had climbed an octave. "I believe it's organic, biological, possibly a parasite of some kind." He was already pulling up the referral form on his computer, typing quickly. "Have you experienced any other symptoms? Fever, nausea, neurological changes?" "No, just the throat. Just this." Sarah's hand went to her neck, her breathing quickening. "A parasite, like a worm. I can't say for certain. That's why you need to see an ENT specialist and likely an infectious disease doctor today. I'm marking this as urgent." The word urgent seemed to drain the blood from Sarah's face. She took the printed referral with shaking hands, the paper crinkling in her grip. Hayes watched her stand, watched her walk to the door on unsteady legs. He'd been wrong to dismiss her initial description as anxiety. The thing on that screen was real, embedded, and judging by its position and apparent attachment to the tissue, it had been there for weeks, growing. After Sarah left, Hayes sat at his desk and pulled up the endoscopic images again. He zoomed in on the creature, studying its segmented body, the way it seemed to have partially fused with her palate tissue. In all his years of practice, he'd never seen anything like it outside of textbooks on tropical parasites. And those cases always came with a warning. Time was critical. Sarah sat in her car in the parking lot, the referral paper crumpled in her fist. The words, "urgent, possible parasitic infection," stood out in Dr. Hayes' hurried handwriting. Her phone showed 3 missed calls from work, 2 texts from Katie asking about lunch plans. Everything suddenly felt distant, separated from her by a thin membrane of unreality. There was something alive inside her, something that had been there for weeks, feeding, growing. While she'd convinced herself it was stress or allergies or grief, manifesting as physical symptoms, she thought of the festival, the wooden bowl, Rodriguez's kind smile, the ant crackling between her teeth, and that soft, squirming texture underneath. Sarah's hand flew to her mouth as nausea rolled through her. She'd done this to herself. Swallowed something that should never have entered a human body, all to prove a point to people who weren't even watching, to prove something to Jake, who'd already moved on, to prove something to herself about bravery when she'd really just been reckless. Her phone buzzed. A text from the OHSU clinic. "Dr. Hayes referred you. Can you come in at 2 p.m. today?" Sarah looked at the clock. It was 10:40 a.m. She typed back with trembling fingers, "I'll be there." The waiting room at OHSEU smelled like antiseptic and fear. Sarah sat in a chair by the window, watching the Columbia River wind through the city below, trying to focus on anything except the sensation in her throat. It had been almost constant now for the past hour, a persistent awareness of something foreign taking up space where only her own tissue should exist. A nurse called her name at 2:03 p.m. The examination room was larger than Dr. Hayes' office. Equipped with more sophisticated machinery, Sarah cataloged each piece of equipment, her designer's eye seeking patterns, order, anything to ground herself in the familiar act of observation. Marcus Chen entered with a tablet under his arm and a calm expression that Sarah immediately distrusted. People only looked that calm when they were hiding concern. "Miss Mitchell, I'm Dr. Chen, ENT specialist. Hayes sent over your images and his notes." He pulled up a stool, sitting so they were at eye level. "I want to do my own examination, but I want you to understand what we're looking at first. Is that okay?" Sarah nodded, not trusting her voice. "Doctor?" Chen turned his tablet toward her, displaying the endoscopic image from that morning. "This is what's in your throat. Based on the segmentation and the attachment method, we believe it's a larval form of Dermatobia hominis, commonly called the human botfly." "A fly?" Sarah said flatly. "There's a fly in my throat. A larva, the immature form." Chen pulled up comparison images on his tablet. Botflies are native to Central and South America. They typically burrow into skin, but in rare cases, they can enter through the oral mucosa, the soft tissue of the mouth. "How rare?" "Fewer than 50 documented cases worldwide of oral cavity infestation." He swiped to another image. "Usually, botflies lay their eggs on mosquitoes or other insects. When those insects bite humans, the eggs transfer and hatch. The larvae burrow into the skin, where they mature for several weeks before emerging." Sarah's hand went to her throat. "I didn't get bitten by mosquitoes. I was careful. I used bug spray." Chen's expression shifted, becoming more clinical. "Tell me about your trip, everything you ate, especially anything unusual." The memory came back with horrible clarity. The festival, the wooden bowl, Mrs. Rodriguez's warm smile. "Ants," Sarah whispered. "Roasted ants. But one of them—" Her voice broke. "One of them wasn't completely dead. I felt it move on my tongue." "And you had any cuts in your mouth at the time? Bitten your cheek recently? Maybe from stress?" Sarah closed her eyes, the habit she'd developed after the breakup. Gnawing at the inside of her cheek during anxious moments, she'd broken the skin on the plane to Columbia. She remembered now, the small wound that had still been raw when she'd bitten down on that ant. "Yes," she said, "the inside of my cheek. It was already cut." Chen nodded slowly. "The ant likely had botfly eggs on it, or possibly even carried a hatched larva. When you broke the ant open in your mouth, with an existing abrasion present, the larva found an entry point. The soft palate tissue is vascular, warm and ideal environment." Sarah felt the room tilt slightly. She gripped the arms of the examination chair. "How long has it been there, based on the sizes in Doc Hayes' images?" "I'd estimate 3 weeks. Maybe slightly longer, which matches your timeline from Columbia." 3 weeks, Sarah had been walking around, going to coffee with Katie, working on design projects, posting carefully curated photos to Instagram, all while something was growing inside her throat. We need to remove it. Dr. Chen continued. Today, the larva is in a position where it could compromise your airway, and the longer it remains, the higher the risk of secondary infection or tissue necrosis. Surgery, Sarah said. It wasn't a question. Minor surgery, but yes, general anesthesia will make a small incision in your soft palate. Extract the larva intact, breaking it would release toxins and bacteria and close the wound. You'll be uncomfortable for a few days, but recovery should be straightforward. Should be. Sarah caught the qualifier. The careful hedge that all doctors seemed trained to deploy. What if you can't get it out intact? Dr. Chen met her eyes. Then we manage the complications as they arise. But I've consulted with Jennifer Walsh, our parasitology specialist, and we're confident in the procedure. We've dealt with subcutaneous botfly cases before. The location is unusual, but the extraction method is similar. A knock on the door interrupted them. A woman in her 40s entered, extending her hand. Sarah, I'm Dr. Walsh. I'll be consulting on your case. Dr. Walsh pulled up a second stool, her manner brisk and reassuring in a way that Sarah found oddly comforting. Here was someone who'd seen parasites before, who wouldn't flinch at what was growing inside her. I've reviewed your images, Dr. Walsh said. The good news is that botfly larvae are relatively predictable. They're obligate parasites, meaning they need a host to complete their life cycle. But they're not trying to kill you. They just want a warm place to grow until they're ready to emerge. That's the good news. Sarah's voice came out higher than intended. Dr. Walsh's expression softened. I know this is terrifying. Having something alive inside your body. Something you didn't consent to, didn't choose. It's violating in a way that's hard to articulate. But from a medical standpoint, this is manageable. We know what it is. We know how to remove it, and we're catching it before any serious complications develop. Sarah felt tears prick her eyes for the first time since Dr. Hayes's appointment. The clinical explanations, the medical terminology, the calm professional voices, it had all created a buffer between her and the reality. But Dr. Walsh's acknowledgement of the violation, the horror of it, cracked something open. I just wanted to prove I was brave, Sarah said, her voice breaking. I wanted to show I could take risks, be spontaneous. And instead She couldn't finish the sentence. Dr. Chen and Dr. Walsh exchanged a glance. Then Dr. Walsh leaned forward, her voice gentle but firm. You're going to be okay. We're going to take care of this. But Sarah, after we remove the larva, I want you to consider talking to someone, not just about the parasite, but about what drove you to take that risk in the first place. Because from what I'm reading in your file, you've been running from more than just a breakup. Sarah looked down at her hands, at the referral paper still clutched in her fist, now damp with sweat and creased beyond readability. Dr. Chen stood. Let's get you prepped for surgery. The sooner we do this, the better. The preoperative room was cold. Sarah sat on the edge of the hospital bed in a gown that tied in the back, her clothes folded neatly in a clear plastic bag labeled with her name and date of birth. The fluorescent lights hummed overhead, a sound that seemed to synchronize with the pulse monitor clipped to her finger. A nurse had already inserted the IV line into her left hand, the catheter taped down with transparent film. Sarah stared at it, at the way her blood pulsed visibly through the thin tubing, and thought about the larva doing the same thing, feeding off her, growing inside tissue that was supposed to be hers alone. Katie had called 3 times. Sarah had sent each call to voicemail, typing out a single text, "Minor medical procedure. I'm fine. We'll call tomorrow." It wasn't fine. Nothing about this was fine. But how could she explain even the truth? Sounded like something from a horror movie. "There's a fly larva in my throat." Felt like words that belonged to someone else's life, not hers. Dr. Chen entered, now dressed in surgical scrubs, a cap covering his hair. Behind him came an anesthesiologist, a younger man with kind eyes who introduced himself as Dr. Patel. "We're ready for you," Dr. Chen said. "Any questions before we begin?" Sarah's mouth felt dry despite the ice chips the nurse had given her earlier. "How long will it take?" "The procedure itself, 20 to 30 minutes. You'll be under general anesthesia, so you won't feel or remember anything. When you wake up, you'll be in recovery." He paused, his expression softening slightly. "This is going to work, Sarah. By dinner time, it'll be out." By dinner time. Sarah tried to imagine that a version of herself just hours away who would no longer have something alive inside her throat. The relief she should feel was buried under layers of dread and shame so thick she could barely breathe. Dr. Patel adjusted her IV. "I'm going to give you something to help you relax. You'll feel sleepy in a few seconds. Just let it happen." Sarah felt the warmth spread up her arm, a chemical calm that made her limbs heavy. The room's edges began to blur. "Wait," she said, her tongue thick. "What if you're safe?" "Done." Patel's voice came from somewhere distant. "Count backward from 10 for me. 10, 9, 8. The numbers stretched and warped. Sarah's last conscious thought was of Jake, of the blue flannel shirt she'd finally donated, of all the ways she'd been running without knowing what she was running toward. Then nothing. The operating room was precisely controlled chaos. Surgical lights blazed down on Sarah's unconscious form, her mouth held open by a retractor, her head tilted back to expose her throat. Dr. Chen stood at the head of the table, peering through magnifying loops, his hands steady as he maneuvered micro-instruments. Dr. Walsh stood beside him, watching the monitor that displayed a magnified view of the surgical field. "There," she said quietly, pointing. "You can see where it's anchored." The larva was larger than the morning's images had suggested. Nearly 2 centimeters long, cream-colored with darker segmentation, its posterior end embedded firmly in the soft palate tissue. A thin, dark tube extended from its rear, the spiracle, its breathing apparatus. Dr. Chen made a precise incision in the tissue surrounding the attachment point. Blood welled up, quickly suctioned away by the surgical assistant. "It's burrowed deeper than I expected," he murmured. "The tissue has actually begun to encapsulate it. That's the body's inflammatory response," Dr. Walsh said. "Trying to wall it off. actually might have been protective, kept it from migrating. Dr. Chen worked in careful increments, separating tissue from the larva's barbed exterior. The creature didn't move under the lights and anesthesia, but its body had a disturbing solidity, a resistance that spoke to how thoroughly it had embedded itself. 12 minutes in, Dr. Chen paused. I need better access. The anterior attachment is under the palatine raphe. More instruments, more careful dissection. The surgical assistant dabbed away blood, maintaining visibility. On the monitor, the larva gradually emerged from the surrounding tissue like something being excavated from amber. Almost there, Dr. Chen said. His forceps closed around the larva's posterior end, gripping the spiracle. When I extract this, have the specimen jar ready, it needs to go to pathology intact. One final, careful pull. The larva released from the tissue with a subtle give. Suddenly, free. Dar. Chen lifted it into the light. The forceps holding it suspended over Sarah's open mouth for a brief, surreal moment before transferring it to the waiting jar. In the preservative solution, the larva curled slightly, its segments clearly visible. It measured exactly 1 centimeters. The surgical assistant sealed the jar and labeled it with Sarah's information. Dr. Chen sutured the wound with dissolving stitches, his movements efficient now that the primary threat was removed. Let's get her closed up and into recovery. Sarah woke to the sound of beeping and the sensation of something wrong with her throat. Not the presence anymore, but absence, a raw, aching void where the pressure had been. She tried to swallow and immediately regretted it, pain flaring across her soft palate. Easy, a voice said. A recovery nurse appeared in her field of vision. Don't try to talk yet. The surgery went well. Dr. Chen will be in to see you in a moment. Sarah's hand went to her throat. The nurse gently pulled it away. Everything's out. You're okay? But Sarah didn't feel okay. She felt hollowed out, violated in a way that transcended the physical. Tears leaked from the corners of her eyes, running into her hair. The nurse handed her tissues without comment, as if crying patients were simply part of the job. When Dr. Chen arrived, still in his scrubs, he pulled up a stool beside her bed. The extraction was successful. We got it out intact, which means no toxins released, minimal tissue damage. You'll be sore for about a week, but you should heal completely. Sarah tried to speak, managed only a croak. Don't talk. Dr. Chen said, just listen. The larva has been sent to pathology for analysis, but Dr. Walsh is confident in the identification. Standard bot fly. You were very lucky, Sarah. Another week, and it could have caused significant complications. Abscess, potential airway compromise, secondary infection. Lucky. The word felt obscene. Dr. Chen seemed to read her expression. I know it doesn't feel that way right now, but you're going to be fine. Physically, anyway. He paused. Dr. Walsh is going to want to see you for follow-up, not just for the extraction site, but for blood work. There are some markers in your preliminary tests she wants to discuss. Sarah's eyes widened. Dr. Chen raised a hand. Nothing urgent, but something that needs attention. She'll explain everything tomorrow when you're more alert. He left, and Sarah was alone with the beeping machines and the ache in her throat and the horrible, yawning question if the larva was out. Why did she still feel like something was terribly, irreversibly wrong? Sarah was discharged the following morning with a prescription for antibiotics, pain medication, and instructions to maintain a soft food diet for 2 weeks. She left through the hospital's main entrance, blinking against Portland's watery sunlight, feeling as though she'd been underground for days rather than hours. Katie was waiting by her car, having ignored Sarah's protests that she could take an Uber. One look at Sarah's face and Katie pulled her into a careful hug, mindful of her friend's fragile state. "You look like hell," Katie said, which was the most honest thing anyone had said to Sarah in weeks. "I feel worse." Sarah's voice came out hoarse, each word scraping against her wounded palate. She'd been instructed not to talk much, but silence felt more dangerous right now than pain. During the drive back to Sarah's apartment, Katie kept glancing over, clearly bursting with questions, but holding back. Finally, as they pulled into the parking lot, she couldn't contain it any longer. "What happened? Your text said minor procedure, but you were in the hospital overnight." Sarah stared at her building, at the window of her third-floor apartment, where everything would look exactly as she'd left it yesterday morning, except she was fundamentally changed. "There was something in my throat. From Colombia. They had to remove it surgically. Something like what an infection, a parasite." Sarah watched Katie's face cycle through confusion, disbelief, and horror. "A botfly larva. I probably swallowed it when I ate those ants at the festival." Katie's hands tightened on the steering wheel. "Jesus Christ, Sarah." "I know. You could have died." "I know." "Why didn't you tell me it was that bad?" Sarah turned to look at her friend. "Because I didn't know. And because when I started suspecting something was wrong, I convinced myself I was being paranoid, that it was stress or grief or my body manifesting anxiety. I've spent so long being told I overreact to health stuff that I stopped trusting myself." Katie was quiet for a long moment. Then, "Jake called me 3 days ago. He asked if you were okay. Said you seemed off in your Instagram posts. I told him you were fine, that the trip was good for you." Something twisted in Sarah's chest that had nothing to do with the surgical site. "What did he say?" "He said he hoped I was right, but that you had a habit of running from things until they became emergencies." Katie's voice was gentle but firm. "He said he'd tried to get you to see a doctor months ago about some tests, and you refused. Is that true?" Sarah closed her eyes. Here it was the other shoe, waiting to drop. "The Walsh wants to see me tomorrow about blood work. They found something in the preliminary tests." "What kind of something?" "She wouldn't say over the phone, just that it needed follow-up." Sarah's hands were shaking. She clasped them together in her lap. "I think I already know, though I've known for a while." The appointment with Dr. Walsh was scheduled for 2 o'clock the next afternoon. Sarah spent the morning in a fog, drinking protein shakes through a straw and avoiding her reflection in every mirror. The surgical site throbbed with each swallow, a constant reminder of what had been removed and what might still be wrong. Dr. Walsh's office was in a different building, devoted to infectious disease and immunology. The walls were covered with cellular diagrams and charts, tracking various pathogens. Sarah sat in the chair across from Dr. Walsh's desk, Katie beside her for moral support. "Dushka." Walsh opened a folder, her expression professionally neutral in a way that made Sarah's stomach clench. Your parasite extraction was successful, and we're not seeing any signs of infection at the surgical site. However, when we ran your preoperative blood panel, several markers came back abnormal. She turned her computer screen toward them, displaying a chart filled with abbreviations and numbers that meant nothing to Sarah. Your ANA anti-nuclear antibody is significantly elevated, combined with your white blood cell count irregularities and inflammation markers. It suggests an autoimmune condition. The words landed like physical blows. Sarah had known they were coming, had been bracing for them since Dr. Chen mentioned the blood work. But hearing them spoken aloud made them real in a way they hadn't been before. "What kind of autoimmune condition?" Katie asked, when Sarah couldn't form words. "Based on these results and what I'm seeing in your medical history, my preliminary diagnosis is systemic lupus erythematosus. Lupus." There it was, the word Sarah had been running from for 8 months, since her previous doctor had first suggested testing after she'd mentioned persistent fatigue and joint pain. The word she'd fled to Colombia to avoid, only to bring back something worse, or so she'd thought. "I want to run more comprehensive tests to confirm," Dr. Walsh continued. "But these markers are fairly conclusive. Sarah, when did you first start experiencing symptoms?" Sarah's voice came out barely above a whisper. "Last spring, maybe March. I was tired all the time. My hands hurt. I thought it was stress from work. And you didn't follow up on testing recommendations." I was scared. The admission felt like pulling glass from a wound. My aunt has lupus. I've seen what it did to her life, the medications, the limitations, the way people started seeing her as sick instead of as herself. I didn't want that to be me. Dr. Walsh leaned back in her chair, her expression softening. "I understand that fear, but Sarah, untreated autoimmune conditions don't go away. They progress. What you've been experiencing over the past months, the fatigue, the inflammation, that's your body attacking itself because it can't distinguish between foreign invaders and your own tissue." "So the botfly set," Katie said slowly. "That was just bad luck on top of an existing problem." "Actually," Dr. Walsh said, pulling up another screen, "this is where it gets interesting. When we analyzed the tissue around the extraction site, we found an unusually aggressive inflammatory response. Your immune system had essentially created a capsule around the larva, walling it off from the rest of your body." Sarah frowned, confused. "Isn't that what immune systems are supposed to do?" "Yes, but the degree of response was extreme. In most botfly cases, the larva remains relatively mobile, eventually emerging through the skin. But yours had become so thoroughly encapsulated that it couldn't migrate. That encapsulation likely prevented it from moving deeper into your throat or toward your airway." The implication hung in the air for a moment before Sarah grasped it. "You're saying my lupus, my overactive immune system, kept the larva from killing me?" "In essence, yes. The same inflammatory response that causes your joint pain and fatigue created a barrier that potentially saved your life. If you had a normal immune system, that larva might have burrowed into far more dangerous territory before we caught it." Sarah sat back, the irony so sharp it was almost funny. Almost, she'd run from a diagnosis that terrified her, fled to another country to prove her independence and vitality, and in doing so, had contracted a parasite that should have killed her except the disease she'd been avoiding had intervened. So what now, she asked. What happens next? Dr. Walsh pulled out a prescription pad. We confirm the lupus diagnosis with additional testing. We start you on appropriate medication, likely hydroxychloroquine to begin with, possibly others depending on your response. We monitor your inflammation markers closely. And Sarah, we talk honestly about what having lupus means because I suspect you've built it up in your mind to be more limiting than it actually is. My aunt is not you. Every case is different. Some people have severe lupus that significantly impacts their quality of life. Others manage it well with medication and lifestyle adjustments. But the key word there is manage. You have to actually treat it. Katie squeezed Sarah's hand. Sarah squeezed back, grateful for the anchor. There's something else, Dr. Walsh said, her tone shifting slightly. I've been reviewing your records, and I see you declined testing 8 months ago. Can I ask what changed, why you came in for the throat issue when you'd been avoiding doctors? Sarah thought about the sensation of movement in her throat, the terror of something alive inside her that she couldn't control or deny. I couldn't pretend it away. The parasite made it impossible to keep lying to myself. Dr. Walsh nodded slowly. Sometimes our bodies force us to pay attention. It's not the way I'd recommend anyone learn that lesson, but here we are. The nightmares started 3 days after Sarah came home from the hospital. She would dream a swallowing, simple, automatic swallowing, and feel something lodge in her throat. In the dreams, she could see it through her own flesh, as if her body had become translucent. A dark to writhing thing that grew larger with each swallow, spreading tendrils through tissue that should have been solid and safe. She'd wake, gasping, hand flying to her throat, fingers pressing against the surgical site hard enough to make it throb. The phantom sensations were worse than the dreams. During meetings with clients, Sarah would feel a tickle in her soft palate and freeze mid-sentence, convinced something had been missed, that a second larva was growing in the exact spot where the first had been removed. She'd excuse herself to the bathroom, stand before the mirror with her phone's flashlight, mouth open wide, searching for darkness that wasn't there. Katie suggested therapy on day 7. Sarah had been mid-panic attack in a coffee shop, unable to finish her latte because the texture reminded her of the protein shakes she'd subsisted on post-surgery, which reminded her of being unable to eat solid food, which reminded her of why she couldn't eat. And suddenly she was hyperventilating in the bathroom while Katie rubbed circles on her back. This isn't just about the surgery, Katie said gently. Once Sarah could breathe again, this is about everything, the parasite, the lupus, Jake, all of it. You need to talk to someone, Sarah wanted to argue. But she was so tired of pretending she was fine, tired of the constant vigilance, checking her throat 12 times a day, tired of jumping at every slight tickle or itch, certain her body was betraying her again. Dr. Lisa Sherman's office was in a converted house near Hawthorne, filled with plants and comfortable furniture that seemed designed to counteract the clinical sterility of medical spaces. She was in her 50s, with gray-streaked hair and the kind of calm presence that made Sarah's shoulders dropped from where they'd been hunched near her ears. "Tell me about Columbia," Dr. Sherman said. After Sarah had sketched the basics of her situation, the breakup, the parasite, the lupus diagnosis, Sarah had expected to talk about trauma, about the violation of having something alive inside her. Instead, she found herself describing the festival, the warmth of the fire, Mrs. Rodriguez's lined face, the moment of decision when she'd reached for that ant, knowing it might not be fully cooked, choosing to eat it anyway. "What were you trying to prove?" Dr. Sherman asked. "That I wasn't afraid? That I could be spontaneous? Adventurous? That Jake was wrong about me?" Sarah's throat tightened, the surgical site aching with the admission. "He used to say I was too cautious, that I overthought everything. When he pushed me to get tested for autoimmune issues, I accused him of trying to make me sick, of wanting me to be limited, but you suspected he was right." "It wasn't a question," Sarah nodded, tears building behind her eyes. "I'd been feeling wrong for months, tired in a way that sleep didn't fix. My hands hurt when I woke up. Sometimes my face would get this butterfly-shaped rash after being in the sun. I knew what those symptoms meant. My aunt has lupus. I'd seen them before. But if I didn't get tested, if I didn't have a diagnosis, then I could pretend I was healthy. I could be the person I wanted to be instead of the sick person I was terrified of becoming." "So you went to Columbia to prove you were that healthy?" "Spontaneous person. I went to Columbia to run away from the truth. Yeah, I just dressed it up as adventure." The words felt like they were being pulled from somewhere deep in Sarah's chest. "And then I ate something I shouldn't have, ignored every safety precaution, all to perform bravery for an Instagram audience that didn't actually care. I got exactly what I deserved." Dr. Sherman leaned forward slightly. "Sarah, you didn't deserve a parasite. You made a choice driven by fear and the desire to avoid a difficult truth, but that doesn't mean you deserve to be harmed. Do you understand the difference?" Sarah wasn't sure she did. The guilt sat in her chest like a stone guilt over ignoring Jake's concerns, over avoiding the doctor's appointments, over the reckless moment that had led to weeks of horror. How could she separate deserving from consequences? "Let me ask you something else," Dr. Sherman continued. "What would you tell a friend who came to you with this story? If Katie told you she'd avoided medical care because she was scared of being diagnosed with a chronic illness, would you say she deserved what happened?" "No, of course not. Then why is it different when it's you?" Sarah had no answer for that. Or rather, she had too many answers, all of them rooted in the impossible standards she'd been holding herself to for years. Be independent, but not isolated. Be adventurous, but not reckless. Be healthy, but also accept limitations. Be strong enough to face hard truths, but also protect yourself from them. The session ended with a homework. Sarah was to journal about the parts of herself she'd been trying to prove or deny, and to notice, just notice, without judgment, when she was checking her throat or spiraling into health anxiety. That night, Sarah sat at her desk with a blank notebook. She'd always been better at visual communication than words, so instead of writing, she began to sketch her own throat, cross-section, the larva, rendered in careful detail from memory, and the medical images she'd been given. The inflammatory response her overactive immune system had created, that biological barrier between the parasite and the rest of her body. She labeled the drawing, "The Disease That Saved Me." The irony was still too sharp to fully process, but staring at her own illustration, Sarah began to understand something. Her body hadn't betrayed her. It had been trying to protect her all along from the parasite. Yes, but also from her own denial, the fatigue that had slowed her down, the joint pain that had made her rest, the rash that had been a visible signal that something was wrong. She'd interpreted all of it as weakness when it had actually been her body's desperate attempt to get her attention. Sarah's phone buzzed with a text. She'd been expecting Katie, checking in as she'd done every evening since the surgery. Instead, the name on the screen made her breath catch Jake. The message was brief. "Katie told me what happened. I'm so sorry. Sarah, are you okay?" Sarah stared at the words for a long time. She could ignore it. Let the message sit unanswered. Or she could perform fine, send back something breezy and dismissive. Both responses were familiar, comfortable patterns she'd fallen into countless times before. Instead, she typed, "Not really, but I'm working on it. You were right about the tests. I should have listened." The response came quickly. "You weren't ready to hear it. I get that now. I just wish I'd found a better way to help." Sarah's fingers hovered over the keyboard. There was so much to say. Apologies, explanations, the twisted story of how her avoidance had nearly killed her and how the disease she'd feared had somehow saved her. But all of that felt too large for a text conversation. Can we talk sometime, not about getting back together, just about everything? I'd like that. And Sarah set her phone down and returned to her drawing, adding details, the sutures that had closed her wound, the medication bottles lined up on her nightstand, the small scar that would remain as a permanent reminder. She drew herself reflected in a mirror, mouth open, flashlight beam illuminating emptiness where the parasite had been. In the final panel, she sketched herself again, but this time looking at the viewer rather than into a mirror. No flashlight, no fear-wide eyes, just her face, scarred throat visible, with a caption that she'd been circling around all week but could finally articulate. "What I ran from caught me anyway. What I feared most kept me alive." I don't know what to do with these truths yet, but at least I'm not pretending anymore. It wasn't hope exactly. It wasn't acceptance either. But it was something, a foothold on the steep climb between denial and healing, between running and facing, between the person she'd pretended to be and the person she actually was. Sarah dated the drawing and closed the notebook. Tomorrow, she'd start the lupus medication Dr. Walsh had prescribed. Tomorrow, she'd set up another therapy appointment. Tomorrow, she'd call Jake and have that difficult conversation. But tonight, for the first time since Columbia, she went to bed without checking her throat even once. 6 weeks after the surgery, Sarah found herself scrolling through an online forum at 2 in the morning, unable to sleep despite the exhaustion that still plagued her body. The lupus medication was helping, the joint pain had lessened, the crushing fatigue had lifted slightly. But adjusting to the diagnosis felt like learning to live in a body that operated by different rules than she'd assumed. The forum was called Rare Parasitic Infections Support and stories, and Sarah had stumbled across it while researching botfly cases. She'd been lurking for days, reading other people's accounts of parasitic infections, some horrifying, some oddly mundane, all of them sharing that same undercurrent of violation and confusion that Sarah recognized in her own experience. Finally, at 2:10 a.m., she created an account, username PDX Survivor. She stared at the blank text box for 20 minutes before typing, "I don't know if this is the right place for this, but I need to tell someone who might understand. 3 months ago, I swallowed a botfly larva in Colombia. It embedded in my soft palate and grew there for 3 weeks before I finally got help. During the pre-surgical workup, they discovered I have lupus, an autoimmune disease I'd been avoiding diagnosis for because I was terrified of becoming sick. Here's the part I can't stop thinking about. The lupus probably saved my life. My overactive immune system created such an aggressive inflammatory response that it trapped the larva, kept it from migrating somewhere that could have killed me. The disease I'd been running from turned out to be the thing that protected me. I don't know what to do with that information. I don't know how to hate and be grateful for the same thing. How do you reconcile being sick and being saved by that sickness? Does anyone else feel like their body is both enemy and protector?" She posted it before she could second-guess herself, then closed her laptop and tried to sleep. By morning, there were 14 responses. The first was from someone with the username Chagas Warrior. "I understand this more than you know. I contracted Chagas disease in Brazil and didn't know for years. When I finally got diagnosed, the doctor said my particular immune response had kept it from destroying my heart muscle. I was furious at my body for being sick and grateful it hadn't let me die. Those feelings can coexist. They're both true." Another from Lyme Recovery. "Your body isn't your enemy. It's doing the best it can with the information it has. Autoimmune conditions happen when the system gets confused, not when it stops trying to protect you. That helped me. Anyway, reframing it from betrayal to misguided protection." Sarah read through every response. Some short, some paragraphs long, all of them reflecting back her own confusion and fear and strange, complicated gratitude. For the first time since Dr. Walsh had explained the inflammatory encapsulation, Sarah didn't feel alone in the paradox. She typed a response. "Thank you, all of you. I've been so ashamed of getting sick, of the parasite, of having lupus, of everything. It helps to know I'm not the only one trying to hold contradictory truths at the same time." The forum became a nightly ritual. Sarah would log in after dinner, read new posts, share updates about her recovery. The community was small but active. People from around the world who'd encountered parasites in ways both predictable and bizarre. But more than the medical details, what Sarah found valuable was the emotional honesty. These were people who understood that having something invade your body wasn't just a physical experience, it was psychological, existential, identity-altering. One evening, a user named Malaria Fighter sent Sarah a private message. "I saw your post about shame. I felt that way too, like I'd done something wrong by getting sick. My therapist told me something that helped illness happens in the intersection of circumstance, choice, and chance. You can't always control which one dominates. You made a choice, yes, but you didn't choose the outcome. There's a difference. Sarah stared at that message for a long time. Circumstance, choice, and chance. She'd been so focused on her choice eating the ant, avoiding the diagnosis, that she'd ignored the role of chance. The specific mosquito that might have carried botfly eggs to that particular ant, the random placement of her bitten cheek that created an entry point, the genetic factors that had triggered her lupus, the fact that her particular autoimmune response had been protective rather than destructive. She'd been carrying the weight of it all, as if she'd orchestrated her own suffering, when, in reality, she'd just been human, imperfect, scared, making decisions with incomplete information. Sarah began writing more than just forum posts. She started a blog, initially anonymous, titled The Parasite Diaries. The first entry detailed her entire experience, from the festival in Colombia to the surgery to the lupus diagnosis. She included the medical details, but focused more on the emotional journey, the denial, the terror, the shame, the strange gratitude, the ongoing process of accepting a body that was both compromised and resilient. She expected maybe a few dozen readers, mostly people from the forum. Instead, within 2 weeks, the post had been shared 3,000 times. Her inbox filled with messages from people with similar stories, not necessarily about parasites, but about avoiding medical care, about chronic illness, about the moment their bodies forced them to pay attention. One message stood out, from a woman named Rebecca. "I've been having symptoms for 6 months that I keep telling myself are nothing. Your story scared the hell out of me, but in a way, I have an appointment scheduled for next week. Thank you for being honest about how denial almost killed you. It might have just saved me." Sarah read that message 3 times, something loosening in her chest. Her pain had a purpose, not a grand purpose, not some cosmic reason for suffering, but a small, human purpose. Her willingness to speak honestly about her experience was helping other people face their own fears. Katie found her crying over her laptop that evening. "What's wrong?" "Nothing's wrong." Sarah turned the screen so Katie could see Rebecca's message. "Someone's going to the doctor because I told the truth about not going." "No, that matters, right? It means something." Katie pulled her into a hug. "It means everything." The blog post caught the attention of Portland Monthly, which reached out requesting an interview for their health section. Sarah hesitated for 3 days before saying yes. The interview would mean using her real name, her real face. It would mean people she knew, former clients, acquaintances. Maybe even Jake would connect her to this story. But she was tired of hiding, tired of shame. The parasite had already taken weeks of her life. The lupus would be with her permanently. She could spend her energy protecting her privacy, or she could spend it on something that might actually help someone else avoid her mistakes. The interview was published in early December, accompanied by a photo of Sarah looking directly at the camera, a small scar visible on her throat. The article was titled "The Traveler's Nightmare: How One Woman's Brush with a Parasite Led to a Life-Saving Diagnosis." Sarah's phone exploded with messages, some from people she hadn't spoken to in years, offering support, some from strangers sharing their own medical horror stories, a few cruel comments from people who thought she'd been stupid, reckless, that she'd gotten what she deserved. Those comments stung, but they didn't devastate her the way they would have 2 months earlier. Dar Sherman had helped her understand that some people would need to believe Sarah had been foolish or irresponsible, because it was easier than acknowledging how easily it could happen to anyone. Blaming her made them feel safe. The most unexpected message came from Mrs. Rodriguez, the woman from the Colombian festival. Someone had translated the article and shared it in local Facebook groups, and it had eventually reached her. Her message, translated by her daughter, was apologetic and heartbroken. "I am so sorry for what happened to you. We had no idea those ants could carry such things. The tradition is very old, and no one in our village has ever gotten sick. But because of your story, we are being more careful now. Thank you for not blaming us, and for teaching us to be safer." Sarah wrote back immediately, assuring Mrs. Rodriguez that she held no blame, that the woman's hospitality had been a bright spot in her trip, that this had been an accident born of circumstances no one could have predicted. They exchanged several messages, building a bridge across the trauma that had connected them. In one message, Mrs. Rodriguez wrote something that Sarah would return to many times in the coming months. "Sometimes the worst things teach us the most important lessons, not because we deserve the pain, but because we are strong enough to find meaning in it anyway." Sarah printed that message and taped it above her desk, next to a drawing of the encapsulated larva. She was building a new narrative, one that didn't require her pain to have been necessary or deserved, but acknowledged that she could choose what to do with it now that it had happened. 1 year after the surgery, Sarah stood at a medical conference in Seattle, invited to speak on the patient perspective of rare parasitic infections. The auditorium held 200 healthcare professionals, their faces attentive as she clicked through slides showing the timeline of her infection, diagnosis, and recovery. But it was the final slide that made several people in the audience reach for tissues. A photo of Sarah hiking in the Columbia River Gorge, healthy and strong, with text overlaid, "The body I feared betrayed me, actually saved my life. The disease I ran from became my protection." Sometimes our greatest weaknesses are our hidden strengths. After the presentation, a young resident approached Sarah with tears in her eyes. "My mother has lupus. She's been so ashamed of it, like her body failed her. Can I share your story with her?" "Please do," Sarah said. "Tell her she's not broken. She's protected." As Sarah drove home that evening, past the rain-soaked streets she'd once wanted to escape, she felt something she hadn't experienced in years: contentment, not despite her scars, but because of them, not in spite of her chronic illness, but alongside it. She'd finally stopped running from herself. Have you ever discovered that what you thought was your weakness turned out to be your strength? What truth have you been avoiding that might actually set you free? Share your story in the comments below. Your words might be exactly what someone else needs to hear today.